Welcome to this month's special programming series, Focus on Cancer, on ReachMD XM 157.
Everybody's talking about changing healthcare in America. One hospital group has done it, and we're going to find out what they're doing. You're listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Dr. Bill Rutenberg, your host, and with me today is Dr. Lise Alschuler. Dr. Alschuler is the president of the American Association of Naturopathic Physicians. From 2003 until January 2008, she was director of the Naturopathic Medicine Department at Cancer Treatment Centers of America, Midwest Regional Medical Center, located in Zion, Illinois, north of Chicago. She is co-author of Alternative Medicine Magazine's Definitive Guide to Cancer, an integrative approach to prevention, treatment, and healing. Dr. Alschuler is currently a member of the Naturopathic Specialist Group in Scottsdale, Arizona, specializing in oncology. Today we are discussing how Cancer Treatment Centers of America created a change in cancer care. Welcome, Dr. Alschuler. I appreciate your joining us at the Clinicians Roundtable.
Thank you very much.
When did the first Cancer Treatment Center of America open its doors?
Well, I don't actually know the exact year, but I do know that Cancer Treatment Centers of America has been in existence for over 20 years. It's really, I think, the pioneer of integrated hospital care in the United States, and I would almost say in at least the Western world.
How did it come into being? Who recognized the need? I mean, what was the basis for this great change in American medicine?
Well, as with most change, it starts, of course, with a personal story. And the owner, it's a privately owned hospital, a sort of hospital chain, and the owner, Richard Stevenson, his mother was diagnosed with bladder cancer. And he, in an effort to really give her the best care possible, traveled the world, seeking out all types of healing and healers that would complement her conventional care, and made a promise to her, sort of on her deathbed, as the story goes, that he would do whatever he could to create under one roof a truly integrated and really solid, scientifically based program for people with cancer. So that's what he did, and he actually started the Cancer Treatment Centers of America with that objective in mind. He's stayed true to it ever since, and the hospital as an organization is very mission and vision focused. It's all about patient-centered, patient-empowered care, utilizing what he refers to as wisdom medicine, by which he means using the best medicine for the patient. And so he has included state-of-the-art conventional care, along with complementary care such as naturopathic medicine, mind-body medicine, nutritional medicine, spiritual counseling, acupuncture, physical therapy, those kind of things.
What specific skills, what specific therapies do you, as a naturopathic physician, bring into the integrated model of care?
Well, the naturopathic physician has a fairly important role there. What we do is provide each patient with an individualized program of supplement recommendations and some what we call lifestyle guidance, inclusive of stress management, sleep hygiene, exercise recommendations, those sort of things. But primarily we focus on supplements that will complement their conventional care. So we work to reduce or help mitigate some of the side effects of chemotherapy and or radiation. We help them to recover more quickly from surgical procedures. And we also use supplements that have their own anti-neoplastic effects to augment the tumoricidal effects of the chemotherapy or radiation. And then finally, if patients make it all the way through conventional care and they're in our aftercare program, then we support them with supplements, again, primarily and other lifestyle recommendations to reduce their chances of recurrence to the best that we know how to do that, and certainly to help them recover from some of the more delayed or long-term sequelae of their treatments.
With all the emphasis on getting people out of the hospital as quickly as possible, you mentioned that you use your naturopathic medicine to speed recovery from surgery. It seems to me that could really be generalized into other illnesses as well. Could you give a sort of a synopsis of what you would do? How do you approach the postoperative patient that results in a faster recovery?
Sure. One of the first things that we recommend is a homeopathic remedy, actually, and probably the homeopathic remedy that most physicians may be familiar with, and that's called arnica. Arnica is the homeopathic remedy that is quite useful for trauma to the body, and it helps the body to recover from trauma.
Where does it come from? Or because I'm not familiar with it.
Arnica actually comes from Arnica, Montana, which is a mountain flower. Homeopathics are an odd sort of medicine in that they're very unlike most other medicines that we use, but they're diluted substances. And in fact, the more diluted they are, the more potent the effect they have in the body. Sort of similar in essence to a vaccine type of theory. So arnica is quite good for helping the body recover from trauma. And as soon as the patient is awake, they can start taking it because it's sublingual, so they can still be NPO and safely take arnica. And then once they're basically eating comfortably, they've passed stool, then they can start in on some supplements. And as you might imagine, after surgery, there's a lot of healing in the connective tissues that needs to occur. So we utilize a specialty type of multivitamin that has nutrients that the connective tissues of the body really need in great quantities to do their healing. Vitamin C, selenium, zinc, those kind of things.
Is there a commercially available preparation, for instance, that I could use in my postoperative patients, or does this have to be prescribed? Is it a formulary prescription that the naturopathic physician would write per patient?
There are several types of supplements that are available, and they all go by different names. The one that we use happens to be called First Intention. But as I said, there's quite a number of multivitamins. Most really good quality supplement companies, when asked, will be able to tell you which supplements might be more specific for healing after injury or surgery.
I'd like to continue the discussion in just a moment, but pause to welcome those who are just joining us at the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Dr. Bill Rutenberg. I'm speaking with Dr. Lise Alschuler, and we're discussing Cancer Treatment Centers of America's model for comprehensive cancer care. You mentioned arnica, you mentioned the vitamin supplement. Are there additional ingredients in that vitamin that we didn't get to, or you want to go on?
Well, essentially, the key ingredients for connective tissue are some of the minerals, calcium, magnesium, manganese, zinc, selenium, and then vitamins such as the B vitamins and vitamin C. In essence, a really high-quality multivitamin could suffice. And then we also recommend fish oil, and that's to help reduce inflammation or the inflammatory costanoid pathways to, again, facilitate healing and reduce some of the swelling, which can ultimately interfere with the healing process.
Is there a dose, number of grams that you think are necessary, or have you found to be necessary for the beneficial effect?
There seems to be most benefit, and you kind of got a little window between benefit and tolerability, but most people, we try to get them to take between 3 to 6 grams of fish oil a day. Each capsule of a good kind of normal-sized fish oil capsule is typically about 1 gram to maybe 1,200 milligrams, and within that there's usually about 300 to 400 milligrams of EPA. And, 2 of those capsules 2 or 3 times a day is the dosage range that we typically utilize with food, of course.
In the current issue of ARPS magazine, Andrew Weil has a column on the anti-inflammatory diet, and fish oil, especially the omega-3s, are really stressing, and he used the range 3 to at least 3 grams a day.
You could do a whole segment on EPA and fish oils, omega-3 fatty acids. They are very helpful, and most of us actually are somewhat inflamed throughout our life, and we could do with a little anti-inflammation.
That's a fascinating discussion of the effects on wound healing. Side effects of chemotherapy are another major adverse effect of the treatment. What have you found to be successful in those areas?
Well, it really depends on the particular chemotherapy. So I could just give some examples. Perhaps one example is a commonly used chemotherapy agent for many different cancer types are the taxanes, Taxol and Taxotere, and they can produce a peripheral neuropathy, which can actually be dose-limiting if it gets severe enough. Interestingly, L-glutamine, which is an amino acid, at 30 grams a day, so 10 grams 3 times a day for at least 4 days following the chemotherapy infusion, is very helpful at reducing that peripheral neuropathy, and that's been demonstrated in at least 2 very well-designed randomized controlled trials. So that's something that, in my opinion, everybody who's getting taxanes should be taking. And if we, in fact, get somebody who's had taxanes in the past and still has peripheral neuropathy symptoms, we can administer the glutamine many months later, and eventually the peripheral neuropathy symptoms will subside.
No, that's good news. As a naturopath, have you used the glutamine for other peripheral neuropathies? I know you specialize in oncology, but again, as a pediatrician, I have several children with chronic pain syndrome, peripheral neuropathies, and I was wondering, is this something that I should consider for them?
It very well may be. There's some interesting data on glutamine in the pediatric population for neuropathies, but also for digestive issues. Glutamine is the preferred substrate for the enterocytes, and so many of the enteropathies really respond well to glutamine. And in fact, that's kind of a second reason to use it in people receiving chemotherapy also. So yeah, absolutely glutamine should be considered.
Maybe I could fix some of my irritable bowel syndrome children with the glutamine.
Yeah, it's worth a try for sure. One other thing on glutamine is people are often afraid to dose it high enough and therefore don't see results. The dose I mentioned will probably sound very high to people that aren't familiar with using glutamine, 30 grams a day. So that would be the one thing I would put out there, is if you're not really seeing the results you think you should see, you might want to consider upping your dose a bit.
Are there any new treatments, any new programs in development at Cancer Treatment Centers of America?
Well, one of the programs that Cancer Treatment Centers has added in the last couple of years is a robust aftercare program that was at the request of our patients, who really felt like once they were done with treatment, they still had issues, but there was no way to sort of catch that. And so we developed an aftercare program where they come back and they get fully evaluated and their issues get triaged to the appropriate service. So they may be set up with a naturopathic appointment, they may be set up to see their oncologist or their dietitian or their physical therapist, depending on what's going on for them. So I think that's very important. In addition, Cancer Treatment Centers is really always adding sort of the latest and greatest technology in cancer care. So we have very sort of state-of-the-art radiation therapy, tomotherapy, PET-CT kind of therapy, and those kind of things. And we're adding a new hospital just outside of Phoenix. So,
well, this has been a fascinating as well as educational discussion for me. If the audience has questions or want to learn more about what you're doing and the programs, where would they go for more information?
Well, there's a couple of places I would recommend. People are certainly welcome to visit my website, which is www.drlise.net. And Cancer Treatment Centers of America website is www.cancercenter.com. And that's a site where they could really learn a lot more about the Cancer Treatment Centers of America website. And then the practice that I'm currently working at is www.insightoncology.com.
And if I wanted a copy of your book, I would go to?
Actually, the easiest place to get it is on Amazon.
Okay, thank you very much, and thanks for being my guest. We've been discussing the integrative approach to cancer care provided at Cancer Treatment Centers of America. I'm Dr. Bill Rutenberg, and you've been listening to the Clinicians Roundtable on ReachMD XM 157, a channel for medical professionals. We welcome your comments and questions. Please visit us at reachmd.com and explore our on-demand and podcast features, which gives you access to our entire program library. Until next time, I wish you good day and good health.
Listen all month as ReachMD XM 157, the channel for medical professionals, as we feature a special series, Focus on Cancer.